my kind of landmark article in 2003 about Accolade. I discovered it, I wrote my article about it, and pretty much across the country, people use either Accolade or Singulair as their only line of defense against hard breasts. The implants themselves are inorganic, and therefore they're immutable. They don't get hard, they don't get soft, they just stay like they are. So it's not the implant that gets hard, the body forms a scar around it, and that scar is known as a capsule. And if that scar is thick and firm, you end up with 2 tennis balls on your chest. If that scar is thin, then you have nice jiggly breasts that do everything you want them to do. Now, capsules are not unique to breast implants. If you get a splinter in your finger, the body will form a capsule around it. If you have a pacemaker in your chest, the body will form a capsule around it. If you get an artificial hip, the body will form a capsule around it. And if that capsule around the artificial hip is really tight and firm, it's painful walking. If you have a tight capsule around a pacemaker, it can literally rip the wires out of the heart. Your body doesn't know that soft breasts are nice and wonderful and something that you're looking for. It just knows that there's a non-self piece of inorganic material inside you, and it forms a scar around it. Accolade is a pill that I use to decrease the scarring around the implant. The group that Accolade comes under are called leukotriene receptor antagonists. Accolade is an AstraZeneca product. Singulair, which people have heard about, it's been on TV, is a Merck product. Accolade hits all 4 of the leukotriene receptors, Singulair hits only 1. So I like Accolade better. But now that it's generic, when we write the prescription, it's for Zifrolucast. I use it prophylactically. I give it to you before we get a hard breast, because I think it's easier stopping the snowball coming downhill at the top of the hill rather than at the bottom of the hill. So I give Accolade for the first 90 days after a breast augmentation. Everything that I come up with is based on assisting the patient get the best results. And I'm more than willing to steal from all the other good plastic surgeons who come up with creative things.